So as well as identifying and treating any underlying medical issues, they might benefit from a referral to an MDT falls clinic. The patient might also benefit from some strength and balance training, and also from equipment or modifications from occupational therapy. So finally, as they report frequent falls, I would want to assess their bone health and their risk of fractures using a tool such as FRAX.
Thank you, Meg. That was a really good, comprehensive answer, which I think really scored really well at interview. The stem of the questions relating to falls and recurrent falls, and you straight away recognise that that's a very important presentation and a very important geriatric syndrome. So really good start right off the bat there. Your approach was really nice, recognising that there's often lots of contributing factors to the falls, and what's helpful in pulling this apart is a really detailed
I didn't have a chance to think about time too much, to be honest with you. I was just trying to make sure I gave the main answers quickly. And I think one thing I learned from the course was front-loading your answers.
Yeah.
So I made sure to do that when answering these questions.
Yeah, no, I think that's absolutely key, because the time just absolutely flies in these interviews, and you've only got 10 minutes and 6 minutes respectively for your clinical cases. So it's a case of getting it all across.
Of urine is a good starting point, but that's not going to give you the diagnosis. So all the symptoms and things you just talked about are really important to drill down into those.
I think as well as the symptoms, so making sure you're asking about certain medications such as diuretics, antihistamines, anticholinergics, as well as alcohol and caffeine intake as well. Voiding diaries that some patients might have can also be really helpful if they're able to complete them. Obviously, not every patient will be able to keep track, but they can be pretty good.
Yeah, one of those tools, it's helpful when it's done properly, but I think we all would be quite bad at remembering to do it properly. It's one of those things that's very easy for us to recommend as doctors, but perhaps not as easy to actually do. I think another key important part of the history is to ask about the impact on quality of life for the patient, because as we mentioned earlier, in terms of work life, social life, sexual life, it can really have a big impact on all these things. And I think it can almost help the patient feel quite validated if you can recognise the impact it has. It's something that may be quite embarrassing, quite difficult to talk about, but if you can recognise the impact it's having, obviously it helps to build that relationship and that trust.
Yeah. So after the history, obviously the next step we have is examination. So several different systems might contribute to incontinence, so it's important to think about what all of these are. A pelvic examination can be helpful to assess muscle strength and assess for pelvic masses or prolapses, and it should always be performed in instances of urinary incontinence. Neurological examination is also important, so looking at lower limb strength, reflex, perineal sensation, and anal tone as well.
I think you're right. The neurological exam can also, give us pointers towards maybe the functional incontinence we talked about. So if there's weakness or mobility issues or difficulties. And in terms of examination in general, it's quite hard to narrow down specifically. If you do look at cardiac examination and perhaps